Hi everyone, my name is Caitlin Fergolia and this presentation will be on the drug ketamine. So what is ketamine? According to the Drug Free Organization, ketamine is a dissociative anesthesia used in anesthesia and for veterinary medicine. Ketamine that is being sold on the streets, however, has been altered from that used in the veterinarian offices. Its chemicals and mechanism of action is similar to those in PCP drugs. It is manufactured as an injectable liquid, but evaporated into a powder form for illicit use. They can also come in tablet or pill form. Some other common names for ketamine are Special K, Kit Kat, Horse Trank, Ket, and K. As mentioned, for illicit use, ketamine is in powder form. Therefore, the route of administration is through oral or inhalation. The user either snorts the powder or dissolves the tablets or pills into a liquid. When snorted, the effects can be felt within 5 to 10 minutes and about up to 20 minutes if swallowed. Ketamine is odorless and colorless, oftentimes being added to beverages without detection. Ketamine can be considered a date rape drug because of its anesthesia effects, sedating and incapacitating victims. It has been used to commit sexual assaults. The feeling. According to the Alcohol and Drug Foundation, ketamine produces psychedelic effects, this causing people to feel detachment from reality and oftentimes having out-of-body experiences. It can cause dreamlike states and hallucinations. A person can hear, smell, taste, and feel things that are not even there or are different from how they are in reality. Users may have intense feelings of relaxation. Like all drugs, ketamine has side effects. Short-term effects of the drug can be hallucinations. Eric Patterson discusses, depending on the user's state of mind, this can determine if the hallucinations will be bad or good. Ketamine will also cause disorientation, drowsiness, an increased heart rate, and elevated blood pressure. Long-term effects can vary depending on if the ketamine is mixed with other drugs. However, some effects include thickening of the bladder and urinary tract. Some long-term users may have to get their bladder removed due to these problems. Kidney problems can also arise due to the drug's interaction with the kidneys. Elizabeth Hartney says, extreme use can cause heart problems, psychosis, brain damage, and seizures. Long-term users can have memory problems, depression, and schizophrenia. The K-hole. According to Amy Keller, the K-hole is a term used when someone takes a high dose of ketamine. They can experience intense out-of-body or near-death experiences, a detachment from one's body and surroundings, causing paralysis and inability to speak. They appear to be in a zombie-like state. This happens because the drug's effects shut off communication between the brain and the body. The user feels no pain or sensation when in the K-hole. Possible depression treatment. According to Robert C. Meisner from Harvard Health Publishing, ketamine is being used and tested to treat those with depression and anxiety. If one responds to ketamine, it can reduce suicidal thoughts rapidly. There are 2 forms of ketamine medications being used to treat depression for those who haven't responded to 2 or more different medications. Racemic ketamine is infused into the bloodstream. This was approved by the FDA decades ago as an anesthesia, but is now being used off-label to treat depression. Esketamine is a nasal spray that was approved by the FDA in March of 2019. There still needs to be more research on which form of ketamine is more effective or how much side effects each produces. The ways in which ketamine work are also being further studied. A low dose is given to treat those with depression than what is typically used for anesthesia. Ketamine has addictive properties, so it is important to notify a doctor if you or a family member have substance abuse patterns. In conclusion, we have learned that ketamine is a very unsafe drug when used illicitly. The drug is currently being tested on its effects to treat depression. When used at a low dose, it can make a person feel relaxed and numb. However, high doses can become very harmful and have negative effects. If you are ever offered to do ketamine, I highly suggest you do not accept the offer. It is way too unsafe and can lead to many negative health consequences. As the photo says above, ketamine is for horses. Leave the drug for medical purposes only.